of the Oncology Clinical Nurse Specialist here at Nottingham University Hospitals. I work with patients receiving immunotherapy, and I know that starting any new treatment can be a worrying and anxious time for patients and their loved ones. Which is why we would like to tell you more about how immunotherapy works, how your treatment is given, any side effects you may develop, and who to contact if you feel unwell.
Cancer has been treated with surgery, radiotherapy and chemotherapy for a long time. However, immunotherapy can now be used for the treatment of many different cancers. It works by helping your body's immune system recognise and attack the cancer cells. The key cancer-fighting immune cell is the T cell. Modern immunotherapy drugs work in various ways to boost the killing ability of the T cells and keep them active for longer. However, the activated T cells may also attack your own healthy cells, such as cells in the skin, bowel and liver. Therefore, the side effects can include diarrhea and skin rash, which will be discussed by our specialist nurse later.
Before each treatment, you will be assessed either by a doctor or nurse specialist. This assessment is important as we need to check that you are well enough for your treatment. If you have been feeling unwell or noticing changes in your condition, you must tell your nurse or doctor. If we know about your condition at an early stage, we can help you manage it and keep you on treatment, even if we have to miss a cycle. It is likely that you will be contacted the day before your treatment to double check you are fit to attend. As part of your assessment, you will have a blood test. The blood test is to check that your body systems, such as your liver, kidneys, thyroid and blood cells are healthy. Once the team is satisfied, our specialist laboratory can start preparing your treatment.
The pharmacist will clinically screen your prescription. This involves checking your most recent blood results, any side effects you may have experienced, and national guidance.
The pharmacy production unit will receive a clinically checked prescription. Your treatment is made in a sterile environment by specialised staff. Over 60 checks are carried out on each treatment to make sure that you receive the right drug, the correct dose, and that the product is safe and in a form ready to be given by the nurses.
After your assessment, you will be booked in to have your treatment. Generally, this will take place within 5 days of seeing your doctor, but may be a little longer for your first treatment. Your doctor can advise you on how often you will be treated. When you come in for your treatment, you will be directed to either the oncology day case unit or the chemotherapy unit. The treatment is given intravenously through a drip into your bloodstream. We do this either through a cannula, where a small tube is temporarily placed into a vein in your hand, or if it is difficult to put the cannula in, then you may have a central line. This is a tube that is inserted into your arm and stays there until your immunotherapy courses are complete. You can come in for your treatment on your own, but if you prefer or are anxious about your treatment, you can bring someone along with you. Morning Tony, nice to see you again today. So, how long is it now that you've been having treatment with us?
I've been having immunotherapy for about 2.5 years now.
So what concerns did you have prior to starting your treatment?
Prior to starting would be not knowing what to expect and the fear of the unknown.
Yeah, so that's really common to hear. Have you had any support through your treatments?
I have. My clinical nurse specialist, Yvette, first port of call for me. I've got a telephone number for her and then email, so I can ring or leave a message and she'll get back to me. And I think for any patient that's got a clinical nurse specialist, that should always be their first port of call as well.
Do you also have the rapid response 24-hour card?
I do.
You know what to do with that?
I do. I know that's available if I need to call somebody out of normal hours or I want to speak to somebody there and then. That's the number that I use. And I know they've got all my details on file as well, all to hand.
Well, that's great to hear. You seem to have had a lot of support. So, do you have any top tips that you could offer for patients about to start their immunotherapy journey?
Arrange to go and have a look at the place, get over that fear of the unexpected, speak to the medical staff and see where the treatment's going to take place and see what happens. Secondly, you don't have to go alone, you can take somebody with you, a friend or relation, they can sit with you the whole time through, which is really good. Third one, have a little patience. I've had lots of treatments and most of the time things go really well, all to plan, and sometimes they don't, sometimes there's a delay. Just have a bit of patience with the staff, they're doing the best.
Well, it's great to see you and great to catch up, and we'll see you for your next treatment.
You will, thank you very much, thanks.
We hope that by having immunotherapy, your cancer will respond. However, sometimes your immune system can cause your immunotherapy to attack your own healthy cells. If you have had any side effects or feel unwell, you must tell your nurse or doctor. This is vital as given further treatment may make the side effects worse and will affect clinical outcomes. Most side effects are often mild to moderate, however occasionally they become serious. It is therefore important that you understand what could occur and how to keep yourself safe whilst receiving treatment and up to a year afterwards. The acute oncology team is made up of experienced nurses who run the rapid response team.
Hello, Rapid Response, can I help?
At your new patient interview, you will be given a blue immunotherapy alert card. This card has a 24-hour, 7-day-a-week phone number that you must call if you feel unwell. You'll be put through to a nurse who will assess and advise you on what you need to do. This may mean attending an oncology day case or our specialist receiving unit for assessment. Immunotherapy can affect any of your body's systems. Before starting treatment, you should think about how you are feeling in general. What is the condition of your skin? Do you have any aches, pains or headaches? What is your normal bowel pattern? How far can you walk without becoming short of breath? And what are your normal energy levels? This is your baseline. You should be looking for any changes that happen after you start the treatment. We're often asked how long it is before side effects develop. This is difficult to answer. However, unless you have an allergic reaction to the treatment, which is rare, side effects tend to develop over weeks and months rather than days.
A very common side effect is itchy skin. A mild rash may develop, but it's not usually serious. This can often be relieved by simple creams or Piriton. If your rash starts to blister or you begin to feel unwell, just call the rapid response team as it may suggest something more serious. If your immune system targets your liver, kidneys or blood sugars, it is generally picked up by blood tests before treatment. However, if during your treatment you notice yellowing of the skin or whites of the eyes, or if your urine becomes a brown colour, this may be a sign that your liver is affected. If your kidneys are affected, your urine output is likely to decrease and become concentrated. If you become very thirsty and are producing lots of urine, this can be a sign that your blood sugar has increased and your body is trying to flush the sugar out. Your immune system can target your large bowel called the colon. If this occurs, you may find you're passing stools more frequently, have diarrhea, watery stools, stomach cramps, blood in the stool, bloating, or have to empty your bowels overnight. If you develop any of these symptoms, you should assume it's your immunotherapy and contact the rapid response team phone line. If left unchecked, your colon can become very irritated and this can lead to more serious complications. Very rarely, your immune system can affect your lungs. If you find that you're becoming short of breath or develop a cough, call the rapid response team. You may need a chest x-ray or a special CT to see if your lungs have been targeted. You may find that your muscles and joints become more painful and stiff. Usually this is controlled by paracetamol or ibuprofen. If your muscles and joints are very stiff and sore, contact the rapid response team or inform your medical team at your next oncology visit. Very rarely, immunotherapy can target your immune system. If you develop tingling sensations in your arms or legs, especially if this develops and gets worse, you must call the rapid response team. If you develop headaches that do not respond to paracetamol, keep returning or are getting worse, if you become more and more fatigued or develop very heavy eyelids or have eye pain, call the rapid response team. Your hormones might also get disturbed. For instance, your thyroid gland or pituitary gland may not work as they should. Signs include headaches, increased tiredness, irritability, feeling cold and reduced appetite. If you notice any of these symptoms or if you feel unwell, you should call the rapid response line. You may need specialist blood tests, scans or x-rays to help identify what the problem is and how we can manage it.
Significant side effects are treated with steroids and usually resolve. You may receive a steroid card to help keep track of your steroid dose. Steroids do not affect how well your treatment works. Many patients do not develop any side effects, so please do not worry unduly. The earlier we detect side effects, the closer we can monitor you and prevent more serious complications.
Finally, if you have any further questions, please discuss these with your medical team or with one of our nurses. Immunotherapy is a new advancement in cancer care, and we wish you well in your treatment. Thanks for watching and good luck.